But night terrors, also known as sleep terrors, are more than just super intense nightmares. These are actually two separate sleep conditions with some pretty important differences, which are important to learn if you're not sure which one you're dealing with. We'll dive into both and cover some ways you can try to stop whichever is plaguing your rest and your sleep. A nightmare is a disturbing dream associated with negative feelings such as anxiety or fear that awakens you. Nightmares are common in children, but can happen at any age. Occasionally, nightmares usually are nothing to worry about. Nightmares may begin in children between 3 and 6 years old and tend to decrease after the age of 10. Although nightmares are common, nightmare disorder is relatively rare. Nightmare disorder is when nightmares happen often, cause distress, disrupt your sleep, and cause problems with daytime functioning or create a fear of going to sleep. You're more likely to have a nightmare in the second half of your night. Nightmares may occur rarely or more frequently, even several times a night. Episodes are generally brief, but they cause you to awaken, and return to sleep can be difficult. A nightmare may involve these features. Your dreams seem vivid and real and are very upsetting, often becoming more disturbing as the dream unfolds. Your dream storyline is usually related to threats to safety or survival, but it can have other disturbing things. Your dreams awaken you. You feel scared, anxious, angry, sad as a result of your dream. You feel sweaty or have a pounding heartbeat while in bed. You can think clearly upon awakening and can recall details of your dream. Your dream causes distress that keeps you from falling back to sleep easily. Nightmares are only considered a disorder if you experience the following: major distress or impairment during the day, such as anxiety or persistent fear or bedtime anxiety about having another nightmare. Problems with concentration or memory, or you can't stop thinking about images from your dreams. Daytime sleepiness, fatigue, or low energy. Problems functioning at work or school or in social situations. Behavior problems related to bedtime or fear of the dark. Having a child with nightmare disorder can cause significant sleep disturbance and distress for the parents. Nightmare disorder is referred to by doctors as parasomnia, a type of sleep disorder that involves undesirable experiences that occur while you're falling asleep, during sleep, or when you're waking up. Nightmares usually occur during the stage of sleep known as rapid eye movement, REM sleep. The exact cause of nightmares is not known for certain. Nightmares can be triggered by many factors, however, including stress or anxiety. Sometimes the ordinary stress of daily life, such as a problem at home or school, can trigger nightmares. A major change, such as a move or a death in the family, can have the same effect. Experiencing anxiety is associated with a greater risk of nightmares. Trauma of any kind can lead to nightmares. Nightmares are common after an accident, injury, physical, mental, or sexual abuse, or other traumatic events. Nightmares are common in people who have post-traumatic stress disorder, PTSD. Sleep deprivation. Changes in your schedule that cause irregular sleeping and waking times, or that interrupt the reduced amount of sleep you get, can increase your risk of having nightmares. Insomnia is associated with an increased risk of nightmares. Medications. Some drugs, including certain antidepressants, blood pressure medication, beta blockers, and drugs used to treat Parkinson's disease or to help stop smoking, can trigger nightmares. Substance misuse. Alcohol and recreational drug use or withdrawal can trigger nightmares. Other disorders. Depression and other mental health disorders may be linked to nightmares. Nightmares can happen along with some medical conditions such as heart disease or cancer. Having other sleep disorders that interfere with adequate sleep can be associated with having nightmares. For some people, reading scary books or watching frightening movies, especially before bed, can be associated with nightmares. Risk factors. Nightmares are more common when family members have a history of nightmares or other sleep parasomnias, such as talking during the sleep. Complications. Nightmare disorder may cause excessive daytime sleepiness, which can lead to difficulties at work or problems with everyday tasks such as driving and concentrating. Problems with mood such as depression or anxiety from dreams that continue to bother you. Resistance to going to bed or sleep for fear that you'll have another bad dream. Night terrors. Night terrors are far less common than nightmares in adults. Night terrors are considered a parasomnia, a type of disorder marked by abnormal occurrences during sleep. These episodes involve sudden bouts of intense fear, screaming, and thrashing around while you're still asleep. Night terrors tend to affect kids more than adults, according to the Mayo Clinic. Almost 40% of children will experience night terrors, but most outgrow them by their teen years. There isn't a similar statistic for night terrors in adults. Much smaller percentage than in children, as the Mayo Clinic describes, but generally they're considered relatively uncommon. One old but often cited 1999 study in the Journal of Clinical Psychiatry interviewed nearly 5,000 adults in the United Kingdom, finding that 2.2% of respondents reported night terrors. What we do know is that night terrors are more common in people with mood or anxiety disorders, as well as PTSD. According to the Mayo Clinic, a few things can trigger night terrors, including sleep deprivation, stress, fevers, and changes in sleep schedules. Sleep apnea, restless leg syndrome, and alcohol use can also increase the likelihood of night terrors. Here are more night terror symptoms to know. One may sit up in bed and look scared. You may even also stare wide-eyed during the episode even though you're actually not awake. You may sweat and breathe more quickly. You may have a quicker pulse and flushed face. You may be inconsolable. You may even wake up and have no idea that you had a night terror. The last symptom is especially worth emphasizing, because if you sleep alone, you could have night terrors and not even know it. Whereas if someone else sleeps in the bed with you, they may be able to tell you about your night terrors. Also noteworthy, a lot of people who have night terrors sleepwalk. We think this is because night terrors and sleepwalking have similar underlying mechanisms in the brain during sleep, because sleepwalking and night terrors can be physically dangerous if you get out of bed and wind up hurting yourself. There are a few key differences that set nightmares and night terrors apart. For starters, nightmares and night terrors typically happen at different points in the sleep cycle. Nightmares occur during rapid eye movement, REM sleep, the stage of sleep when vivid dreaming is most likely to happen, according to the American Sleep Association. Night terrors typically happen during non-REM sleep, specifically stage 3 sleep. This stage is also deep sleep, and when extremely slow brain waves start to appear, interspersed with faster waves. Another major difference between nightmares and night terrors is how you might react when you wake up. With nightmares, you may wake up easily and still feel scared or uncertain or any other number of negative emotions, but ultimately be able to think clearly. But when it comes to night terrors, one may be hard to wake up and be confused and terrified if someone does not manage you to wake up well. Let's examine sleep paralysis briefly. Few things sound more terrifying than waking up not being able to move. and being convinced a demon is sitting on your chest. Unfortunately, for people with sleep paralysis, this might be just another night. This REM parasomnia involves being unable to move your body for a few seconds or minutes when falling asleep or waking up, according to the National Sleep Foundation. People who have experienced it often talk about horrifying images and sensations, like being attacked by a supernatural force. But what's really going on here? Personally, I've had a few of these sleep paralysis attacks, and they are disturbing. However, during REM sleep, your brain relaxes your muscles to the point that you are more or less rendered immobile. For safety reasons, over time, we've developed that because you don't want to act out your dreams. The process is called atonia, and it keeps you from acting out your dreams. Episodes of sleep paralysis do usually end on their own, or might stop if someone touches you or talks to you, and isolated incidents typically aren't a major cause for concern, but reoccurring episodes are sometimes linked to narcolepsy, a sleep disorder that involves drowsiness and sudden sleep attacks. This can be most disturbing during the day while you're driving. Lack of sleep can additionally increase the risk of sleep paralysis, but sleep paralysis can be triggered by stress or related to mental health conditions like bipolar disorder. If you're experiencing persistent sleep paralysis, or if the episodes are making you anxious, you should see a doctor. Additionally, to addressing lifestyle factors that may be contributing to these episodes, antidepressants called selective serotonin reuptake inhibitors, SSRIs, can suppress REM sleep, which may help alleviate symptoms. That being said, in my next video in this series, I will cover some ways to get a more restful, peaceful sleep.